everyone, and welcome back to
Guess That Molecule.
Both of the molecules have similar chemical formula and structure. Which of the two are safer in patients with cardiac disease?
The answer is levobupivacaine. Good job. Join us as we dive into the exciting world of isomerism and how different arrangements yield different properties. Let's go.
Hi everyone, welcome back to Mastering Anesthesia. Today we're going to talk about isomers. So what are isomers? So isomers are molecules that have the same molecular formula, but whose atoms are arranged differently. So they have different structural arrangement. Isomers can be classified into two broad classifications. Number one, structural isomers, and number two, stereoisomers. Before we move on further, let's explore the overview of isomerism classification. Now, this is very important and it should be imprinted in our heads. Now remember, isomers can be classified into two broad categories, structural isomers and stereoisomers. Under structural isomers, you have chain, positional, and functional isomers. Meanwhile, for stereoisomers, you have enantiomers and cis-trans isomers. There is also a special type of isomers called dynamic isomerism or tautomerism, which can be classified under structural isomers. Okay, so now let's dive into more detail about structural isomers. Structural isomers, they are compounds that have the same molecular formula, but they are arranged differently, meaning they have different chemical structure because the atoms are arranged differently. An easy way of thinking about this is to think of it as Lego pieces, where you have similar number of pieces, but when they are arranged differently, like so, they will have different shape and thus will be translated into different physical properties and pharmacokinetic, pharmacodynamic properties. Okay, so the first subdivision of structural isomers is chain isomer, wherein the carbon skeleton varies, but the functional group remains in the same position. It is easy to remember, so when the isomers we're talking about is chain isomers, so it is that chain, that carbon skeleton that changes. So next, for positional isomer under structural isomers, the carbon skeleton remains the same, but the functional group changes in position. So simple, when the isomers we're talking about is positional, it is the position of the functional group that changes. Famous example of this in anesthetic practice is enflurane and isoflurane. So you have different arrangement of chlorine and fluorine atom on the carbon skeleton that will give you either the molecule is on enflurane or isoflurane. Next, now that we got the hang of it, functional isomers, the carbon skeleton remains the same, but the functional group changes. Example of this is alcohol and ether. Next, a special form of structural isomers, tautomerism or dynamic isomerism, wherein two structural isomers or tautomers can coexist in equilibrium. The position of the equilibrium depends highly on the condition where the molecules are surrounded. An example of this is midazolam, a 7-membered ring benzodiazepine. It can have an open ring structure or a closed ring structure depending on the pH of the surrounding environment. If midazolam is prepared in an acidic environment, it has an open ring structure, making it water soluble. So this structure of midazolam, when injected into the blood being acidic, it will have less pain on injection. Midazolam, when exposed to pH more than 4, will have a closed ring structure. This will give it lipid solubility, exerting its action once it crosses the blood-brain barrier. Other examples of dynamic isomerisms are thiopenton, which alternates between keto and enol form, as well as morphine, alternating between ketone and enol forms. Now moving on to the second broad classification, stereoisomers. Stereoisomers are compounds with the same molecular formula and chemical structure, but they have different spatial arrangements. Let's have a look. Let's have a look at enantiomer as an example. They are mirror images of each other, but they don't superimpose. Example, our hands. They are perfect example mirror images of each other, but if we try to superimpose them, that is, we put one hand over the other, they do not form exact same arrangement. Therefore, they have the same compounds, they have same molecular formula, same chemical structure, but because of the arrangement is different, they cannot superimpose and they are not one and the same. Stereoisomers can be further classified into enantiomers or cis-trans isomers. They have older names. Enantiomers previously are known as optical isomers and cis-trans geometric isomers. So enantiomers or optical isomers, they have a single chiral center consisting of either carbon atom or an atom with 4 other atoms bound to it. They form mirror images of each other, but they don't superimpose, like the example of the hand that I just showed earlier. And because they have the same molecular and chemical structure, they have identical physical and chemical properties. So what distinguishes them one from the other? It is observed from the pattern that they rotate polarized light will give them the characteristic of levo or dextro or S or R. So enantiomers, they rotate polarized light equally but in opposite directions. Previous nomenclature we used levo and dextro, where levo stands for left is when it rotates light anti-clockwise, whereas in dextro it is the other way around, where clockwise rotation of polarized light is observed. Each enantiomer is either an R rectus or S sinister form. This is distinguished according to the direction of atoms attached to the chiral center in ascending atomic number. This can get slightly confusing, so let's have a look. Now imagine we have in an enantiomer carbon center with atoms W, X, Y, Z attached to it with different atomic numbers. W being 10, X being 11, Y being 12, and Z being 13. W having the lowest atomic number, we stick it into the screen. So we have the C carbon atom here with W, imagine it already piercing the screen. And watching from above, we have X, Y, and Z sticking out from the carbon chiral center. Counting from highest to lowest, Z being the highest and X being the lowest, it rotates in a counterclockwise. Leftwards, counterclockwise. This is known as the S enantiomer or sinister enantiomer. If the direction is clockwise, meaning X, Y, and Z, X having the higher atomic number and Z having the lowest atomic number, this will be called a rectus or R isomer. There are a few important enantiomers in anesthetic practice. Examples are bupivacaine, ketamine, etomidate, all having S form and R forms, as well as zopiclone, S-zopiclone, citalopram, escitalopram. General rule of thumb, the S form, or the sinister, is usually the good guy, contrary to the name of it being sinister. It usually has better potency and safety profile. Example from these are bupivacaine, S-bupivacaine or levobupivacaine, and esketamine. They have better safety profile. But it is not always true, because in etomidate, the R isomer or etomidate is better, as in it has greater potency compared to S-etomidate. Now there are a few other terminologies that you have to be familiar in isomerism, one of it being diastereomers, wherein they have more than one chiral centers, meaning that they cannot form mirror images of each other. Famous example of diastereoisomers are itricurium, where it has 4 chiral centers. From this, it has 10 different structural arrangements. Next under stereoisomer is cis-trans isomers or geometric isomers. They possess a double bond which the attached atoms cannot rotate. It has cis form and we have trans form. Let's remember the spelling should be as S-I-S, cis. So SS, same side. Cis form, they are arranged on the same side of the double bond. Extracting from example, we have cis-2-butene, where the CH3 molecules are arranged on the same side of the double bond. Now we know that cis form exists on the same side, therefore trans form, the groups are arranged on opposite sides of the double bond. Example, trans-2-butene, you can see the CH3 are arranged on opposite ends of the double bond. Other examples here in cis-trans isomers is mivacurium. We are done with the classification of isomers. Now, there are a few more terminologies that we have to be familiar with in isomerism. One of it is racemic mixtures. They are drugs that are presented as a mixture of isomers. When the drug has one chiral center, the different enantiomers are present in equal proportions, and this is known as a racemic mixture. Different enantiomers, equal proportions, one mixture. Examples: isoflurane, warfarin, bupivacaine, ketamine, adrenaline, and atropine. They are all racemic mixtures. So what is the importance of knowing all these isomers? What is clinical relevance of isomers? They may have identical molecular formula and physical properties, but the difference in pharmacokinetic and dynamic properties are what concerns us anesthetists. We can use this to our advantage, preferring a drug that is more potent, less toxic effects to use in our anesthetic practice. For example, as ketamine, it has greater affinity for the NMDA receptor, making it more potent, and it has more pleasant experience for the patients and also quicker mental recovery. As warfarin, on the other hand, it is more protein bound, meaning it has lesser volume of distribution, more potent, and its half-life is significantly less compared to our warfarin. So as warfarin has a half-life of 32 hours compared to our warfarin of 54 hours. And then we also have halothane and enflurane isolaflurane, which are all isomers. They have different anesthetic potency. And S-bupivacaine or levobupivacaine, now it has less cardiotoxic effect as compared to its counterpart, our bupivacaine. So knowing all that brings us to enantiopure preparation, which is the opposite of racemic mixture. They are drugs prepared with only a single isomer, which we have chosen the most active and the least toxic isomer to be of the enantiomer preparation. Examples of enantiopure preparations are etomidate, S-bupivacaine or levobupivacaine, S-ropivacaine, S-ketamine, S-ketoprofen, S-medetomidine, or the other name for which we are more familiar with is dexmedetomidine, and our noradrenaline.
Thank you for watching. If you find these videos helpful, please hit the like and subscribe button to show your support. Comment down below what topic you want us to cover next. Till next time, see you in the next video.